Hi, welcome. This is Anna Jyoti at the School of Fine Tuning. I'm going to talk today about pregnancy and reflexology, and also a bit about fertility and reflexology and pregnancy and first trimester, second and third, and labour. I do have a video called Points for Labour, and you can just search it up. I think it's called Points for Labour. If you put Anna Jyoti Low, Points for Labour, it should come up. And I show you the points for labour. So certain practitioners have come to me, some practitioners have come to me, many who have done reflexology before but just don't feel confident or feel that they are equipped to manage doing reflexology for a pregnant woman. Similarly, I know that some, one particular insurance company would require you to have a pregnancy reflex course, which I teach. If you need an additional certificate, I provide that. A little bit like, I suppose, pregnancy massage. So you can check with your providers whether you need to have pregnancy reflexology, or as a reflexologist, I feel that you're equipped to treat pregnant women. And anyway, so let me talk about that. Let me speak to that about what I feel. So first of all, we know that when you're doing reflexology for fertility, you are invited to bring both. Not you invited. It's advised to request and invite both parties, so the man and the woman, to come. To come for regular reflexology in preparation for their fertility process, and then to come sort of between day 7 and day 14 of menstruation for the woman and for the man to come, and ideally I would say, just ahead of ovulation. So it depends on how long the cycle is, but just ahead of ovulation. So, 2 days ahead of ovulation would be really good to come and have reflexology. And then when I'm doing that, I'm really working with my sticks and my bits, I've got crystals, I've got obsidian points, I've got all sorts. And so really working firmly into the pituitary, into the adrenals, into ovaries, uterus, fallopian tubes, really working and focusing on those reflex areas and those reflex points in particular. And for the guy, I would be working, of course, adrenals, pituitary, adrenals, testes, prostate, testes, vas deferens. So yeah, really working on the reproductive and adrenals. And adrenals produce sex hormones. Pituitary is the master gland. And then also the head and the brain, the nervous system, calming the nervous system, reducing stress also through the adrenals, and just rebalancing the energetics, and with intention as well. I always say, let's do this in my mind. I'm giving the intention energetically to create the perfect space for consummation and fertility and impregnation, and for the sperm to reach the ovum and to penetrate the ovum and for it to be pregnancy. So yeah, I have a lot of intention when I'm treating fertility. So then during pregnancy, I would always recommend that the first trimester is just contraindicated for the first 12 weeks. Just let the baby embed, let the zygote, the embryo, let it embed into the endometrium, let it get into its normal processes. And then certainly by 13, 14 weeks, you can come back and have regular reflexology. Now, during regular reflexology in trimester 2 and 3, we avoid all the reproductive areas. We avoid ovaries, uterus, fallopian. We don't go so crazy stimulating pituitary. We'll massage the pituitary because we want everything to sort of keep balance, the internal environment to keep in balance, and also for the hormones. But I wouldn't necessarily actually be putting my stick into the pituitary gland during pregnancy. So really quite soothing, quite nurturing, but calming the nervous system, working everything, but maybe not so hectic on the points, not so deep on the points. And then from, let's say, 38 weeks, depending on whether it's your first baby, second or third or fourth or fifth or whatever. Certainly I know with a lot of first pregnancies, women like to go full term to 40. Full term is actually 38, but they like to go full term to 40. And then there are points for labour. So coming up to like 38 weeks, you can start to really stimulate pituitary and get the pituitary really ready for producing its oxytocin, the prolactin, and the adrenals, and getting everything ready. So that's very cool to do that. So from 38 weeks, you would then switch to my points for labour, of which I would be doing kidney 3, spleen 6, liver 3, large intestine 4, gallbladder 21. Have I missed anything? Maybe bladder 60 for a bit of pain relief if they are already going into contractions. We'll talk about labour in a minute. But yeah, I would be really working on those points, and of course the uterus. Let's get contracting the uterus, pituitary, adrenals, everything. Really working it as you would originally, but going particularly firm with your points or your sticks into the reproductive and pituitary, really getting ready for labour. I always say to ladies when they come, I say, look, I will have a word. I'll have a word with your baby and have a word with your internal environment. But if your baby's not ready to come, it's not going to come. It's not going to come until it's ready to come. But we could have a word. It's like when I do acupuncture as well. I say, acupuncture is so strong and so wonderful. And these are the points that I would needle. And they're even just as powerful with points and using your stick or using your there's all sorts of tools and acupoints that you can use, and if you haven't got that, you can use a chopstick or a biro lid or something like that. But yeah, or your knuckle, just to go deeper. Anyway, I'll say I'll have a word and I'll do my best, but there's no promises. But we have huge success with this. And then also, like, right in labour, I mean, personally, I feel that if you are requested to do some reflexology for a woman who's in labour, I would just be going along going, how can I best be of service to you? How can I support you? Can I just massage your feet? Can I just soothe you? Can I stroke your hair? Can I do some pressure on your back, on your low back, around your hips? Can I massage your legs? What would you like? And if she's like, I would like reflexology, then just do regular reflexology and the points for labour. And really go for the points for labour, so that perhaps she might have started labouring and then it stops and not progressing. That's often the case. So if you're not progressing, you want to do points for labour. So yeah, you can just repeat those for you. It's kidney 3, liver 3, spleen 6, large intestine 4, gallbladder 21. Even something like do 20 is a good one as well. So yeah, they would be the points that I would use. I'm just thinking if there's anything else, and gallbladder 60 as well for pain relief. I hope I haven't missed one. But anyway, Google points for labour and you'll see my video on that. And then postpartum, let mum bond and embed and get in. And I would say, after your 6-week check, come and have some more reflexology, and just, if you can, bring your baby in a sling, sit on a chair, and I'll do some reflexology. So I hope that helps. Really, we don't want to overstimulate during the actual pregnancy period. If it's at 33 weeks, we don't want to be overstimulating at that point at all. So if someone comes anywhere between 12 and 38 weeks, we're doing soothing, sort of medium pressure rather than our usual firm pressure, but medium pressure, and completely leave out all the reproductive around the heel. You can massage around the heel, but just don't do any points or any walking or any points. But you can soothe, and of course you can soothe. So hopefully that helps. And if you have any questions, please do ask. Just as a word, on products using. So, of course, when you're using any balms during pregnancy, please use plain balms during pregnancy. Beforehand, you could be using geranium, clary sage, rose, all sort of lovely fertility balancing hormones ahead of conception, and then also during labour, or from 38-40 weeks, you can be using clary sage, rose, geranium, bergamot. Get all those lovely oils in that can really help and support uterus delivery, being uplifted. Bit of frankincense in there as well for in case there's any fear or anxiety around that. So there's lots more to talk about, but I think this is a good introductory chat. I'm just thinking on the top of my head if there's anything I've missed. The other thing is, when you're doing, if you've got somebody who's coming, make sure ahead of time you kind of know what they are, where they're up to in their pregnancy. So, if they're 28 weeks, know what they're growing that week. It's really cute to be able to go, oh, I'm just reading up on you. Or, you might not see them until they arrive and then they tell you they're 28 weeks pregnant. But it's kind of nice to be unflappable. I think that's, for me, is the main thing that I teach any pregnancy treatments and training, is to be unflappable around a very pregnant. That's what the course and the teachings are, is how to be completely unflappable, non-judgmental. Don't tell them what they should, and you should be doing this, you should be doing that. Oh, what about this? And what about that? And don't do that, and don't do this. And you should just be non-judgmental, loving, unflappable, and very calm. And we want to be calming the nervous system, working on the big toe, really calming the spine, the spinal cord, all the nerve branches, vagus nerve, all through the feet, working energetically to calm. Certainly working on the heart reflex as well, to calm the Shen and to calm the spirit. They're my teachings when we do 5 elements. There's lots to talk about. I don't want to go on too much, but so yeah, just watch your products and essential oils during the time of treating pregnancy. Be unflappable. Know where they're up to. Be non-judgmental. Just be really supportive and loving, and just reassuring. Women are very, very naturally capable of giving birth, and also that if they encounter complications and need to go into C-section, is that we are able to cope with that as well. And as long as it's all for the intention of getting the baby out safely, then it is what it is. So yeah. If you have any questions, sometimes I say this and people comment and then I don't have time to answer. So forgive me if I don't get time to answer you, but immediately. But I try to. But there's lots of other information all over the internet about pregnancy and reflexology, I am sure. So this is just my opinion. It's not like the authority. It's how I would work as a practitioner. This is what I do. I'm not the reflexology police, nor am I the pregnancy reflexology police that you have to have an additional certificate. But I know that certain insurance bodies require you to have that. So if you do, then please do come and train with me. And I have IPHM accreditation for pregnancy reflexology. I also do pregnancy massage as well. So good luck. I hope that helps. Just be cool. Be cool. And, just be yourself. Be your nurturing, loving self. And if I've missed anything out, I'll place it in my own comments. But I think that's it. I'm just talking freely without having any notes. So there you go. So much love. Thank you so much for watching. Bye-bye.